back to Kular Hospital, Bija.
Thank you.
We are honored to have you here.
I think this is my 4th or 5th year visiting,
Yes, sir.
and so I feel at home because of your kind hospitality, and
Great,
it's
great.
exciting to be here with, is this another American?
Yes.
Yes, so we have 2 from USA here in India,
And one from India.
and 1 from India.
The
This is
good
good.
thing is, patient is from US,
Yes.
and my godfather, my teacher, Professor Rutledge, Dr. Rutledge.
And I'd like to comment, having been here, and I told this to Bridget the other day, I've had the good fortune to go around the world. So I have operated in the United States, in California, and North Carolina, and Florida, in Missouri in the center, and in the north of Michigan.
Wow.
But not only that, I've been in all throughout Europe. I've been in England, both the north of England and London. I've been in France and Paris multiple times. I've operated in Germany, the Czech Republic, in Spain, in Italy, in Sicily, and then all around India. And so I've had an experience to see other doctors and hospitals. And I had the good fortune to look at Dr. Kular's patients, his operations, and his results. And I'd be happy to say that Dr. Kular's results are equal to or better than any other hospital in the world, including the best hospitals in the United States or anywhere else in the world. So,
Oh, thank you very much, sir. I think it will be too much.
No.
I'm not that good.
no, we have the data. No, we looked at your data. We were very cautious about this. I've seen the management. And when I had a family member who needed surgery, I brought that family member here, and her surgery was very successful. And so I'm really pleased that he was kind enough to offer, and that patient is doing great, and we have a lovely granddaughter. So thank you again, Dr. Kular, from our
Thank you, sir.
family to
Thank you,
yours.
sir. That's my
Yeah,
duty,
absolutely.
and I feel honored to have operated on one of your.
It's a
family members.
testimony of your
Yes,
good
it's a great
quality.
testimony for
and,
our hospital,
Yeah,
for
absolutely.
my work.
Yeah, yeah.
Great, thank you,
Yeah.
thank you. So Bridget, how did you find us?
I actually found you online. I had been researching several countries and I decided on India. And I had read up on you online and your webpage and watched some videos and chose to come here.
Okay, tell me, so what were your expectations and what you got here? Is there a match between the two? Are you happy with your surgery? Now it's like you are 5th, 6th or 7th day now? Yeah. So how do you feel about our facility, our surgery and post-operative care? Do you want to comment on that?
Yes, everything was absolutely wonderful. I came in with no expectations, so everything has gone exceptionally well. I was up and at it the next day after surgery, walking around, drinking liquids. 3rd day I was on semi-solids, I believe, yes. The facility is very small, comfortable, quaint. The staff is absolutely wonderful, very, very kind-hearted and warm, and the facility is very clean. It's nothing like the big hospitals in America. Very, very nice, very quiet. So, but everything
Right,
well
so you
exceeded.
feel like being at home?
Yes,
Good,
definitely.
good.
Yeah.
And I came to know you are going to malls, doing shopping and
Yes.
going here and there every day. That's
Yeah.
good. So you are having fun in India.
Yes,
Great,
very
great,
much.
great.
Very
And to
much.
our good luck, now today we have Dr. Rutledge, who is the father of Mini Gastric Bypass, and he has done, he actually invented this technique, and he has done the maximum number of Mini Gastric Bypasses in the world, and he is training all the surgeons throughout the world. And let me tell you, he has done too much for India, for Indian surgeons. He has converted whole of us to MGB surgeons. Actually, we were all doing sleeves and Roux-en-Y's earlier, and when we used his surgery, then I came to know that how big the difference is. Even you wanted a sleeve, I think.
Yes, yes.
Earlier, she called me. So now you are eating.
Yes.
So had I given you sleeve, I would have told you to be on liquid diet for at least 1.5 months.
Yeah.
So this is luxury. Do you have any nausea, any vomiting?
No, not at all.
Not
It's
at all.
been
So,
great. It's
Yeah,
been
so
very
this
good.
is what is MGB. It gives you the luxury to eat and lose weight at the same time. Dr. Rutledge, what do you want to comment about this?
I think there are very, maybe 4 or 5 important points. And one of the things that we heard at our recent conference in Delhi, India, was that the MGB appears to be at least as good or better than any other kind of operation for weight loss. But one of the things we've kind of recognized is although the steps in performing the mini gastric bypass are straightforward and clear, we have seen that some surgeons who lack the knowledge of the details of the little tips and pointers that make the MGB so good can have problems. And so one of the things I want to emphasize is we're really thinking that it's in expert hands where we see the really best results with MGB. We often find surgeons who are good, honorable surgeons and skilled with other techniques can bring their knowledge to MGB and it doesn't match, so that patients then can suffer with more nausea and vomiting than you have had. We can see people who have great skills in the sleeve and the Roux-en-Y and the band. When they apply that same knowledge to the MGB, it's not a match. And so as an example, what we expect in your case with the MGB is you're going to eat less, okay? You're going to eat fewer calories. So we have a medical term for that. It's called restriction, okay? Restriction. And what we'd like to describe for you for a second is the difference in your restriction and the restriction you might expect to get if you had a lap band or a sleeve or the Roux-en-Y. And if that's okay, I'll talk about that for a minute.
Sure.
Okay? In other words, you're eating less than you would normally, correct? Yet you said something else which is very interesting and very exciting to me. I think you said, or it seemed like you were saying, that you're pretty comfortable.
Yes.
You're not vomiting.
No.
You don't have pain. Okay? You're eating less, but without a feeling of discomfort. If you look at patients who've had the sleeve, the band, and the other operation called the Roux-en-Y, we see the opposite. We see them eating less, which is good. We wish for that. We want people to eat less because one of the problems is that we have more calories going in than we need. So we want you to eat less. But what we see with the other operations, and I think Dr. Kular has seen that with his knowledge as well, is that with a sleeve, it hurts. So we call that a blockage, or the medical term for that is obstruction. So you try to eat something and you have that pain if you've ever taken a bite that's too big and it gets stuck. Well, the sleeve is a tight, narrow pouch with a closed valve called the pylorus at the end. And so if you talk to them, and we've talked to Dr. Kular's patients, frequently they will say after surgery, I'm not comfortable. We were recently at a meeting and they call it the pukes. So they are constantly in pain and throwing up. Now we like the fact that that patient is eating less, but I feel bad if that patient is uncomfortable and unhappy because they can't have the kind of joy of having a snack but eating. And so we call the difference, that difference, obstructive restriction with the band and the sleeve and the Roux-en-Y. It's a blockage. It's just as if someone was choking. And that's not a pleasant image. Whereas the MGB, you eat and you go, I'm feeling full, I think I will stop.